Hello everyone, my name is Carlos Cacao. Today I'm going to talk to you about this topic, which is called early or delayed cardioversion in recent onset atrial fibrillation. So to begin, we're going to see the definition of this topic. So this topic's definition is, this topic aims to discuss whether there is superiority in early cardioversion for recent onset atrial fibrillation when compared to delayed cardioversion, which is a wait-and-see approach that uses rate control medication instead of full-on electrical cardioversion or pharmacological cardioversion. Um, let's watch a video first so that we can get in context about atrial fibrillation. Let's see. Okay, now that we've watched this video, to get into context, we can continue with the presentation. So let's go to the next part, which is the application in medicine. It is very pretty obvious that being this topic being so important, uh, with the results of this investigation will have a direct application in the treatment of the patients, because it will enlighten on which treatment option is better, whether to use the um, new idea of a wait and see approach or to continue doing common practice, which is immediate cardioversion. So now that we have that clear, we can go to the next part, which are the pros and cons of this wait and see application method. Um, so the pros are that you can actually observe that spontaneous conversion of atrial fibrillation to sinusoidal rhythm uh, is an event that occurs frequently, and it has been demonstrated in the study. The need for pharmacologic or electrical cardioversion was reduced, which is a good thing since these procedures have their own risks. So it is important that they can be performed as least as possible. Also, time spent in the emergency department during the initial presentation may be reduced, which is interesting since this study demonstrated that the the more visits associated with delayed cardioversion with the wait and see method um, did not implicate more time spent for the patient than an early cardioversion method. So let's now talk about the cons. The cons are that it does not eliminate the symptoms early, since early cardioversions are performed. So we only apply rhythm medication, so symptoms do not are not eliminated. Also, cardioversion or spontaneous conversion, either of the methods are an important trigger for stroke. So the stroke risks are not reduced. We have similar clinical outcomes in that matter. So anticoagulation medication is very important, uh, which without even if we choose early cardioversion or the new approach. So let's watch a video on the treatment of AF. So with this part complete, we're going to continue with the video, with the next part. Since we watched this video, we're going to talk about the issue in Ecuador. So it is important to mention that cardiovascular diseases are the most common cause of death in Ecuador. So the top four diseases responsible for this are heart failure, myocardial infarction, atrial fibrillation, and high blood pressure. So this means that AF is very relevant in our country, and we need to be aware of it, be able to diagnose it, and treat it properly. So this topic is very important in Ecuador. The fact that this topic is about treatment is even more important since we can see here that it is a major cause of death. So being able to treat it properly is a major must. Um, Another thing to say that is important is that AF can be subclinical, and it has been reported as underdiagnosed in our country. So proper diagnosis is something very important, as we have seen. It can be done very easily. So let's look at a video about it. We found that video, which is very short. So now we can see that those are really good methods to diagnose the atrial fibrillation. Let's go to our final point, which is the conclusion of this study. In conclusion, we can say that patients presenting to the emergency department with recent-onset symptomatic atrial fibrillation, a wait-and-see approach was non-inferior to early cardioversion in achieving sinus rhythm at 4 weeks. This is the conclusion of the study. Of course, we have talked about the advantages of this approach. Uh, so, as a final word, we can say that you can choose any of the two approaches. Both have similar clinical outcomes. So we have to individualize each case and each patient in order to pick the best method possible so that it can be the best one for the patient that we are taking care of. So this has been it. So thank you for your time and have a good day.